This video shows how to don and doff personal protective equipment, or PPE, used for 2019 novel coronavirus. These guidelines are adapted from CDC guidance. Please refer to the written step-by-step instructions for donning and doffing PPE that are available on the Emergency Management webpage for more detailed information. First, long hair should be secured with a tie. If a bouffant is desired, don it now. This is preferred for communal PAPR hood use. She then performs hand hygiene with alcohol-based rub. Please note that the hand hygiene steps throughout this demonstration are abbreviated for sake of time. Next, Steph chooses the appropriate respiratory protection, in this case, a powered air purifying respirator, also known as PAPR. Place the battery pack and filter unit at the small of the back and fasten the belt around your waist snugly. Connect the PAPR tube to the hood, ensuring that the two fit together, and put the hood on. Turn on the PAPR battery pack and filter and ensure proper airflow and battery level. Eye protection is not necessary as it is integrated into the PAPR hood. Steph visually inspects all PPE prior to donning to assure that it's not torn or ripped. This demonstration uses a launderable gown ensemble. Steph puts on her reusable gown, making sure it's secured and she's able to move unrestricted. She then dons gloves and ensures the cuffs are pulled over the gown sleeves, ensuring that the gloves fit properly. Steph makes sure she's comfortable and able to go through a range of motion while remaining correctly covered. Now she's ready to enter the room. As Steph exits the room, she knows her PPE is contaminated and she should follow doffing guidelines carefully so she doesn't contaminate herself. Steph moves towards the door, gets an Oxivir wipe, and wipes down the door handle. Now, Steph removes her gloves. These can go into regular waste. Steph should then remove her gown, being careful to touch only the insides of the gown. If using a disposable gown, break the gown ties with gloves still on now by grabbing the gown and pulling forward until they break. The gown should be turned inside out as it's removed, and then it can be placed in the soiled linen hamper, or, if it's disposable, into the regular waste. Then, Steph will perform hand hygiene again. Now she can leave the room. Outside the room, Steph should perform hand hygiene. And don clean gloves. Steph should now remove her respirator. She removes the PAPR by tilting the head slightly forward and removing it back to front. Then, she wipes down the inside and outside of the hood, the tubing, and the battery pack, keeping the belt fastened for ease of cleaning. She then disconnects the tubing and places the reusable components in an appropriate container or designated area. Steph can now use Oxivir wipes to disinfect the outside door handle and any counter surfaces she used. Steph removes and discards her gloves. If a bouffant was worn, it can be discarded now. Finally, she performs hand hygiene one last time.